and now I have them on a slideshow. What I'm hoping to do is to share with you something that I have been following very, very carefully, right from the moment that, it became quite apparent that the pandemic of the COVID-19 was affecting all of us, and I have been following the number of cases, the number of deaths related to the pandemic, and most recently also the mental health or behavioral health impact of the pandemic as well. So I want to share some data, some thoughts about that. Are you recording, Cassie? Thank you. So let me start with this to give you kind of a big picture. And this comes from the Kaiser Family Foundation and the CDC data as of April, the middle of April. And of all these groups by states, and there is data even at certainly at the zip level, at the county level, zip code level, census tracts level. This kind of gives you a big chart, at the state level. And the one that I'm emphasizing, and if you don't mind, I'm going to be focusing on Latinos primarily, although there are tremendous disparities that are happening with other racial ethnic groups like African Americans and Native Americans as well. I would like to focus the attention primarily to Latinos. And as you can see there, that I'm highlighting the difference of how this is playing out in California in terms of Latinos. That even though Latinos comprised of about 39% of the population, or 49 or 40%, the number of deaths actually surpasses that of the representation in the population, as you can see in those percentages. And I'm going to walk you through something that has been, of great interest to me to focus on in real time, how these things are playing out as time has gone by. I have been following the county of San Diego in terms of the number of cases and number of deaths. And there are several reasons for me to follow San Diego. But what I would like to call your attention is that this particular data that you see there is from April 17, which is when I started to almost daily to look at the number of cases and number of deaths. First, I'm going to focus on the number of cases. And if you can see there, I'm highlighting that the percentage of Latinos in San Diego County, in terms of the percentage of total persons with known race ethnicity, it represented 41.7% of the San Diego County population. And this is, by the way, over the representation of Latinos in San Diego County, but I'll make that point a little bit down the road. The other thing that I want to let you know is that at that time, the number of deaths per 100,000, actually the number of cases per 100,000 population was about 63. So 63 to 100,000. In the case of African Americans, which has been a contrast statewide, the number of cases at that time per 100,000 folks in in San Diego County was basically 61%. So almost a week later, look at those numbers. Those are increasing. Look at those numbers a few days later. Remember when we started with about 63 per 100 cases? Now we are a few days later, about 2 weeks later, double those numbers. And it may be a function also that more people are being tested. But, you know, and there is also an increase with what's happening with African Americans. 7 days later, another increase. Same thing with African Americans. And the latest that I'm gonna share with you is what happened this weekend. Actually on yesterday, as of yesterday, it is now 261 cases per 100 population. There is also an increase in African Americans, but that gives you kind of a dynamic tendency or trends of how this is playing out with Latinos as more cases are emerging, okay? Now, I'm talking about deaths. This is mortality. So as of yesterday, if you take a look at, you know, about 41% of Latinos with known demographics was happening in Latinos, a little bit more with whites, and then the percentage of deaths in African Americans, about 2.5. This is yesterday as well. If you notice, the number of deaths back in May 9 was 66 in Latinos and 74 in whites. Just a few days later, it increased to those numbers that you can see there, okay? There is certainly an increase. And what I want to call to your attention is that if we were to look at these numbers only, it tells you a very partial picture of what the dynamics that have been having in San Diego County. Look at this is the representation of the various ethnic groups racial ethnic groups in San Diego County. As you can see, 64% are comprised by whites and 32% by Latinos and only 5% by African Americans. So there is a disproportionate numbers of deaths, certainly cases, also deaths in, you know, in this case, Latinos and African Americans. I want to also call your attention to this website that back in, I think that it was April 25th, that I got a phone call from an LA reporter, LA Times reporter, Ben Poston is his name. And he said, have you seen the data that was just posted in the California Department of Public Health? And I said, no, I haven't seen it. So he sent me the web link, and he and his colleagues did a special analysis of the data back in, once again, April 24th, which was when he brought that to my attention. Actually, it was on the 25th. And what you see there actually is the latest information. If you go to the same website, this is what you are going to encounter, okay? As of May 19th. And this is how the website looks like. So you can have a sense. So let me walk you through other fascinating information that was, you know, the LA Times reporter wanted to have a sense as to what would explain that younger Latinos and younger African Americans were dying at a much greater rates than older cohorts, you know. So what you have there is overall, you know, this is on May 19th, the percent cases in Latinos was 54% basically, and the percent deaths of all the deaths in San Diego County was basically 38%. And the percent of the population in San Diego County is about 38, 39%. This is the same thing with African Americans. And if you notice, if you compare overall, this is all the ages together. In African Americans, they are almost twice the number of deaths in terms of the representation in the population. With Latinos, it's not apparent because it is across all the ages. But when you break down by age groups, and that was the point of the LA Times at that time, was why this phenomenon of the younger generations of Latinos and African Americans seem to be dying at a greater rates than the older generations. So look at that. This is ages 0 to 17. And fortunately, there hasn't been any reported deaths in San Diego County. But look, the percent of 0 to 17 in San Diego County of Latinos is basically 48%. But the percent of cases that were presented, all the cases was in that age range, it was basically 78%, okay? And with African Americans, the percent cases of deaths was lower to the representation in the population, okay? Now, these are ages 18 to 34, and look at those numbers. You know, the 67, almost 70% of the deaths were attributed to Latinos, and the same, almost similar with the cases. And look at the percentage of that age group in the population. So there is a disparity, a clear disparity there. Look at the African Americans. Here, in this age range, 18 to 34, you start seeing also a disparity in the number of deaths in African Americans compared to the percentage in the population. This is another age group, 35 to 49. Look at those numbers again. You know, disproportionate numbers of Latinos in that age group, 35 to 49, had been dying. You know, we're talking about what, 3/4 of the population in San Diego County, you know, who of the total population are Latinos in terms of their mortality. This is 50 to 64, and look at that. You know, it is also disproportionate. And look at in African Americans, that age group, 50 to 64, is dying twice the rate of their distribution in the population. Whereas if you take a look at whites, actually they are way underrepresented in terms of who is dying. And this is a statewide, by the way. Excuse me, this is not San Diego County, this is a statewide. If I said San Diego County, I was mistaken. It is a statewide. So this is ages 65 to 79. Also disproportionate numbers for Latinos. Certainly disproportionate numbers for African Americans. And with whites continue to be kind of a lower count, okay? By the way, this is when the LA Times reporters contacted me, he sent me this Excel table to bring to my attention that if we take a look at age groups, let's say 18 to 49, 50 to 64, and the age 65 and plus, and you create ratios of younger versus older folks, that there is an increased ratios of number of deaths in Latinos. Can you see my cursor here? Yeah, in Latinos, you know, in the younger generations, and it is kind of totally different to the curve or the increases in the white population, as you can see here. Something similar with African Americans, the 18 to 49 had the greater ratio of, you know, number of deaths compared to age 65 plus. So he wanted, the question was, why? This is a phenomenon that I, quite frankly, I hadn't seen it before. It took me a little bit by surprise. Thank goodness that he sent this information to me before we had an interview. And I tried to come up with the best possible, you know, reasons why a phenomenon like this might be happening. This is, by the way, the paper that Ben Poston, you know, along with a couple of colleagues, that they published, and that was on April 26th. And the California Healthcare Foundation got that news and started to disseminate it. And that was on a Saturday, okay? By the following day, the news was all over the country. It was really, it was being, this is one of the venues in which this was being reported. And you know, I got another call from a New York newspaper, not the New York Times. It was another, it's called The City. And what they wanted to have my take on what is happening in New York City. And what they presented is that the two cases, you know, what this incredible divide between Flushing, which is a neighborhood, and Corona, another neighborhood. And there are differences in terms of course, who comprises those two neighborhoods. And this is what they were reporting in this particular piece, that there was this survey that 50% of Latinos in New York know someone who's died from the virus more than any other ethnic group. And one of the bottom lines was that Hispanic and Black New Yorkers have died of coronavirus at twice the rate than that of whites and Asians, according to the Department of Health and Mental Hygiene, as of April 30 at that time, okay? This is a piece that I strongly recommend that you take a look at it. It was published in JAMA, the Journal of the American Medical Association, by three very well-known people. You know, Dr. Owen, Dr. Carmona, who used to be the US Surgeon General, and Dr. Pomeroy, Claire Pomeroy, who used to be the Dean of the School of Medicine, the medical school at UC Davis. Now she's leading you know, what would be the equivalent of the Nobel Prizes, but here in the US, the Lasker Foundation. And this is one of the key quotes that I extracted from there. In New York, Hispanic and Black people accounted for 34 and 28% respectively of deaths from COVID-19, even though they represent 29 and 22% of the population, while white people accounted for 27% of deaths, even though they represent 32% of the population. And then they went to Chicago, Louisiana, and other places to highlight, you know, exactly the same thing. And the point that they were making is that these disparities really were presenting a picture of how, as a society, our health system here in the US, and political systems as well, you know, they had been failing to address some of these issues to specific populations. And there has been so many articles, you know, that I had been across to that make this point, how this emerging situation, which is all over the place now, has pointed out to the failures, once again, national failures in the healthcare system to really deal with all populations, especially, you know, the vulnerable populations. So this is related to what came up in the LA Times, you know, that, and I made the point, I said, you know, a big difference, I can bet you, that Latinos, youth, young Latinos, they don't have the luxury to stay home. You know, they have to go and work to make a living. And there has been a lot of reports, you know, newspaper articles across the nation making that point. This is the California Healthcare Foundation that, you know, came up with a very well-documented piece on that for Latinos, staying at home was not an option available. And therefore, you know, they are exposed Just think about it. I'm sure that you can come up with many, many reasons. You know, they work in the service industry, the construction, in food preparation, in janitorial work, that is way underpaid. But, you know, they are exposed without appropriate personal protective equipment at that time. You know, this is in Texas. Few days later, Texas undocumented desperate for work amid coronavirus, even if it means getting sick. You know, Latinos and other groups, I'm not just speaking about Latinos, we tend to be very resilient. You know, it's a point that I would like to make a little bit later. And strong and strong will, you know. We are doing the agricultural jobs that other groups wouldn't even dare, you know, getting into. And that is, to a great extent, part of the resiliency that we have. This is, you know, in Los Angeles, people in poor areas of LA are infected and dying at twice the rate of wealthier neighborhoods. And part of the headline of you know, these quotes from that piece is people in low-income communities like Dahlia's neighborhood in South LA are infected with the virus at twice the rate of those in wealthier communities, according to a data provided by the county. Residents of those low-income communities also are more likely to die of the virus. And then provides some information about that. This is very recent, you know, came up this week. The price of being essential. Latino service workers bear brunt of coronavirus. And they are, you know, they are deemed to be essential workers. For low-paid employees whose work is rarely even ever glorified, the people who clean the floors, do the laundry, serve fast food, pick the crops, work in the meat plants, having the jobs that keep America running has come with a heavy price. By the odd calculus wrought by the viral outbreak, they have been deemed essential, and that means being a target. And this is what we are starting to see, you know, for weeks now, play out in terms of mortality rates, that our younger generations are dying because of this issue. You know, that not only the kind of jobs with little security that they have, little protection, but also they return to households in which they tend to be very densely populated, you know, sometimes with 2, even 3 families within the household. And by the way, according to this piece in this news, this article, you know, family members are scared to death, you know, and those breadwinners are also very scared about bringing transmitting the virus within the family as well. This is a study, very interesting study, very illustrative, that was done in San Francisco's Mission District. I'm quite familiar with that because I spent some time at the University of California, San Francisco, and I was working out of the San Francisco General Hospital, which is right in the epicenter of the Mission District. So here, notable was that those who tested positive had much in common. The vast majority, 90%, could not work from home, and 75% were men, even though men accounted for just 55% of the study participants. And also, just a little bit more information, nearly 90% earn less than $50,000 a year, and most live in households of 3 to 5 people. Almost everyone who tested positive, 95%, was Latino, even though Latinos represented only 44% of study participants. It was a remarkable study, a community-based study that tested as many people as they could from the Mission District. I'm going to change a little bit of gears here because I wanted to, you know, illustrate how morbidity and mortality is playing out with vulnerable populations But the other crisis that we are experiencing right now, and it's getting worse, is the mental health crisis. Is going to augment the devastation in many respects if we don't do something that is systematically intentional, purposeful, and that has enough funding to really deal with this. This approaching wave of mental injuries will be met in coming months by a severely broken system, which is the point that Dr. Owen, Carmona, and Pomeroy were making. This just came out today. This is in the Wall Street Journal, and in this one, and I know this person, I cannot say well, but I'm on the National Advisory Council of SAMHSA, the Center for Mental Health Services. And every time that we get together, Dr. Eleanor McCain-Katz, who is a psychiatrist, who for several years was at UC San Francisco, she's quoted in saying, a second coronavirus lockdown could pose great risks to the nation's mental health. This is what she said. But look at this, is the increase in the number of suicides, fatal drug overdoses, and instances of domestic abuse will be broad, deep, and long-lasting. And indeed, that's going to happen. This is a representation coming from the state of Washington, which for some time it was the epicenter of morbidity and mortality as well. And they had been putting together just remarkable materials. This representation that you can see here comes from disaster preparedness. What is it that we have learned, after there has been disasters? And they try to adapt this to the pandemia that we are all experiencing. And there are different stages, this went back to March to 2020. And at that time, they were saying, this is going to be dominated by anxiety, some panic about the unknown, the fears, the uncertainty, then acting out or acting in, with hopelessness and withdrawal of increased substance use, aggression, law breaking. That's what they were anticipating. Then depression, grief, and loss become more significant clinical issues. And then I'm highlighting that about 6 months into when this started to play out, that they are expecting that there's going to be a significant increase in suicide rates and domestic violence rates as well as a significant increase in child abuse, because it is inevitable. The children are at home full time, and they don't have teachers who can spot that there are signs of any kind of abuse, especially physical abuse. And I saw 2 days ago a report that says that nationwide the number of child abuse cases has come down, which is very bad news, let me tell you. It's very bad news because there is nothing to explain why this has been coming down, other than there are no ways to report it. There is no way for the school to have a watchful eye, or the neighbors or other relatives, as to what is happening. So this is going to exploit in many more ways than one. I just wanted to share that concern with you as well. 2 days ago, also, there was a report on the number of calls of domestic violence mounting nationwide. And this will continue. This will be, as you can see in this model that I'm showing you, the suicide rates and domestic violence rates increase. This is just a few days ago in Time magazine, in the latest issue. Maybe they already have a different issue, but it was the psychological toll of the pandemic. And what they are reporting is that roughly 70% of Americans experience moderate to severe mental distress, triple the rating seen in 2018. And this is a quote from the lead author from San Diego State University. She says, expected there to be an increase, but even I was surprised how large it was. In some ways, there is a perfect storm for mental health issues, she says. We're dealing with social isolation, anxiety around health, and economic problems. And all of these are situations linked to mental health challenges, and these are hitting many of us at once. This is a national survey by the Pew Research Center, and as you can see there, at least, 33 plus 16, 49%, excuse me, 30 plus 27% were reported feeling nervous, anxious, or on edge. 68% had trouble sleeping. 76% felt depressed, and 81% plus 11 had a physical reaction when thinking about the outbreak. This is manifesting in important ways. This is a cry for help, data of cry for help, for us to pay attention to that. This is, the California Healthcare Foundation, through a survey agency. They have been doing almost weekly polls, looking at different things. And what I'm presenting here to you as of April 24th, that the answer to the question is, in thinking on the last 7 days, how has your mental health has changed, if at all? You see there that there is a percentage of those who have gotten a little worse and gotten a lot worse. And the group that has either gotten a little worse or a lot worse are Latino, primarily, okay? This is at the state level. I still have just a few slides left. This is coming, actually, I just got this from SAMHSA. And this is the treatment gaps, people who are in need of services because their mental health disorders or suffering from substance abuse disorders. And, the percentage who are not receiving treatment. For example, in the case of substance use disorder, and this is the case of Latinos, okay? Basically 90% who are in need of these services are not receiving services, 9 out of 10. And with COVID-19, which alcohol and drug disorders are increasing, I can bet you that it's even less than that, okay? So you see the immensity of the need that is represented here. Same thing, this is co-occurring, any mental illness and substance abuse disorders. You have 93%, once again, who are not receiving services. Something similar with African Americans, it's a little less in terms of the treatment gap than with Latinos, but they are up there as well. So this can give you a sense of how these things are playing out. And I'm convinced that unless there is a focused attention and there are resources, focused specifically to deal with this mental health crisis, things are going to get very bad. And I think that you who are on the trenches, is very likely that you are observing this already. I think that if we were to allow ourselves to reflect and think, this being at home, working remotely, is having an impact on all of us. And it is very important that we assess that, we monitor that. And if we need to, to reach out as well, I think that it's very important to do that. One thing that I would really want to emphasize is that one of the protective factors that we Latinos and African Americans, Native Americans, every population have resiliency. And a definition is the human ability to persevere in the face of adversity and demonstrate the capacity to overcome and self-regulate, to deal with past, present, and future traumas and challenges. There is this little model here in which you have some, examples of adversities. I already spoke about, child abuse, domestic violence, elder or older adult abuse as well, abuse of people with disabilities, all of that. Those are definitely adversities. And then how do we adjust to that through protective factors, how we self-regulate, and how we minimize risk factors, and how the sense of belonging has something to do in mediating, the actual outcomes, like mental wellness, onset of mental disorders, management of chronic diseases, etc. This is the last slide, basically, is to, how this plays out. Well, these two, I have a book that I bought, when I realized, is this book right here. It's called Resilience, the Science of Mastering Life's Greatest Challenges. And these 10 habits roughly came from there. And it is things like stay optimistic, practice altruism, cultivate a strong moral compass, embrace faith and spirituality, use your sense of humor, find positive roles, identify positive social supports, don't avoid anxiety-provoking situations, but to face them, and find meaning in life and embrace training. This thing about find meaning in life, it is of critical importance. It is remarkable how, even though we are, many of us staying at home and trying to protect ourselves and our families, that there are ways in which we can keep, wellness, and we can be physically fit as well. I'm going to stop here to see if there are any questions. I'm going to stop sharing. And sorry that it took me this long to share this information with you. But I think that is so important that we are aware about the mental health and substance abuse issues, and to inform others, because as we anticipate, many of my colleagues and myself, suicide rates will appear, and they are already happening, as well as other, mental health impacts. In terms of just if you consider, the percentage of those who are unemployed, and the unemployed are increasing in a rampant manner. And it's expected that 20% of the US population is going to be unemployed. And as you know, this doesn't happen uniformly. In some areas, I'm sure that it is going to reach 50% unemployment, perhaps even more, and with certain populations as well. So let me stop here. And if you have any comments, questions, I would love to hear from you.
I just thank you for the information, Sergio. It's very, as you say, very depressing, but we need to know. In Sonoma County, we have 67% of the Latinos, the persons with COVID-19 are Latinos, and it's amazing. But my question is,
what is the representation of Latinos in Sonoma County?
37%.
Wow. Yeah.
So my question is, I have been working with the Latino community for many, many years. What it will take to make a switch, a huge change, so we can, when we come back to the next crisis, we won't have this situation. And I have to leave soon because I have all the staff meeting, but I really appreciate the information.
Sure. Let me tell you that there has been major uh, reports and articles that I have seen by people who have a lot of credibility, like Don Berwick, for example, out of Boston. He used to be the director of the CMS agency under the Obama administration, who have have given interviews, for example, at JAMA. He has also a paper in JAMA, which is excellent. It's very good. I'll be happy to share that with you. And what he is emphasizing, Nubia, is that we have this window of getting it right, and if we don't, then it will continue. It will be even worse, than before, because recovering from the economic downturn that this is getting us into is not going to be easy. And who knows? It's likely that there's going to be a second surge. We still don't know. Experts in these areas are forecasting that we might see it. The estimated number of deaths by those who had been putting together models of epidemiological, modeling are very sobering. Very sobering. So I think that we better start making adjustments as to how we can deal with these situations in the best way possible, and to collectively advocate for more resources.
Thank you. Thank you. I have to leave for the next meeting, but thank you very much.
Thank you, Nubia.
Sergio, that was
Sarah.
a wonderful presentation, really rich data. I'm so glad that you presented it. It is, as others said, depressing, but important to see, and especially in relation to the behavioral health slide and the uptick in suicide. One thought that's coming to mind for me, having just interviewed all the youth promotoras for LSP, and really one of the things that the youth kept talking about again and again was the usefulness of the QPR suicide prevention training. Mm-hmm. So many quotes, so many statements about how helpful that was. And one thing that comes up is thinking, well, is there a way we can get that training out to more people? Can it be virtually done? Can we just, create an army of people who are ready to go with QPR?
Mm-hmm. Yes. Yeah, no, thank you, Sarah, for sharing that. I appreciate it. And do you know anything that we have actually, like these slides and all the sources that I use to prepare the slides, we'll be happy to share that with all of you. This is meant to really to be sharing and to support each other, on these most remarkable times.
Thank you, Sergio. I hesitate to unmute because my niño is running around crazy, but I think everyone is kind of feeling very somber right now, and we're seeing that. But I really thank you and appreciate you for putting the last two slides around resiliency and things to note for, because I think those of us who are in the trenches and in the ground working, we're starting to feel it heavy on our shoulders, and that sense of responsibility of how we can help our communities. And I know I see it personally, I see it with our team members. And so I think I really appreciate and thank you for highlighting that, because I think that's something that we need to recognize and be mindful of, also on how we can also support those who are serving in addressing behavioral health, because it affects them as well.
Yeah. Well, thank you, Cindy. I really appreciate your comments and your words. And let me tell you, down the road, because this is one side of the story, okay? There are other sides, more positive sides of the story, about self-care, about, how to take care of ourselves. And it would be great if we engage in that conversation as well.
Yeah, I think That would be very, very helpful. I like to always be positive, and I have the harmony way. I want things to be always okay. And so to me, that was the thing that I stuck to. I was like, I looked at those list of items that you shared and kind of making sure that to remind to find that meaning in life and how we can educate others as well in terms of kind of taking those tips también. So
that's right. And there are others. I made a presentation to a group, of Latino leaders across the U.S. and Mexico. And I put together some slides that I'll be happy to share with you as well. Cassie, I'll send those to you as well, and please feel free to make them available. And whenever you want to talk more about this, I would love, the thing that I really would love to for me, it would be really good is to hear from you as well. The adaptations that you are making in your daily lives, working with the populations that you are serving, the community you are serving, and to because those can be incredibly helpful for many other organizations as well. How are you handling all of these challenges? What is working for you? What is working for the populations that you are in touch with? That would be very valuable. And I think that if we are able to collect that systematically, we can absolutely do good for other groups as well, and for ourselves as well. No, I have no question about that. And Cassie, I'm looking at the clock, because I really don't want to take more time of what we have scheduled. I want to respect that as well.
No, thanks, Sergio. And I think we could probably all, I don't know, keep talking about it, or there's also, I think, a lot to digest here. Yeah. But I think, perhaps the next meeting we can dig into a little bit more of what folks are doing and kind of reflect on your presentation. I will definitely send the recorded version out as well as the slides to everyone, and I know those who couldn't make it, I think, will be interested as well. So if anything, I think we can continue the conversation, and next time maybe it is more around mitigation and solutions and things like that, and learning what everyone's doing. So thanks again for a really great presentation.
Thank you, everyone. I really had been isolated for what 9 months. It feels like 9 months. But I had surgery a few days ago, and my ophthalmologist gave me the green light. This is my first Zoom session in kind of a week. So it's great to see you, and truly to see you. So please take care of yourselves and be safe. Okay.
Great. Thanks, everyone.
Thank you. I think we're checking in.
So some of us are hopping on the next line over.
Yes, yeah, we will. Okay.
All right. Thanks, everyone.
Adios.
Thank you.
Adios.
Gracias. Gracias, Cassie.
Thank you, Sergio.